I'm also happy to have Dara Simon, partner in tax services at Cherry Bekaert in the Tampa office, and she is a hospitality and retail practice leader. She will be our moderator, and she will introduce our panelists for today. She has 17 years of professional experience. She has an absolute great record of community involvement with several universities, including University of Florida, and other of her partners are also involved in initiatives within I just remind you, there is a Q&A box below. You can put your questions there and we will be happy to forward them to our participants. So without further ado, I give the word to Dara. Good morning.
Okay, good morning. Again, my name is Dara Simon. I'm a partner with Cherry Bekaert. I'm also the hospitality and retail industry practice leader for Cherry Bekaert. Little background, Cherry Bekaert is a top 25 regional CPA firm focused on accounting, advisory, and consulting services with offices throughout the Southeast, including a couple of offices in South Florida. So I'd like to welcome everyone to the 2020 Business Forum. We'll be talking about the South Florida Business Outlook. So before we get started, I just wanted to let everyone know that this morning's session does qualify for CPE and CLE credit. So throughout the presentation, there will be a series of polling questions that will come up every 15 minutes. And in order for everyone watching to get credit, you will need to respond to those polling questions. So we'll make sure we let everyone know when those polling questions do pop up so everyone can get the credit if they need that. So with that, we'll go ahead and get started. We've got a great group of panelists. So to get started, I'm gonna ask each panelist just to introduce themselves, tell us about their business and what the current state of their business is. And to kick us off, we're gonna start with Henry. So Henry, if you want to start us off.
Good morning, everybody. My name is Henry Pujol. I'm Senior Vice President at Royal Caribbean Group. In my role, I oversee the accounting, tax, and several of the shared service finance functions. And I've been with the company for about 16 years now. As part of the cruise industry, basically, South Florida is rather unique. This is the headquarter of the cruise industry, the big three players being Carnival, NCL, and ourselves are all based within several miles of each other here in South Florida. We're one of the largest employers in the area. The industry as well, prior to this year, really has been an industry of growth. We've been adding more and more passengers that are taking cruises, that enjoy the cruise experience. I think our product really fits in very well with just overall consumer trends, moving more and more toward experiences as opposed to buying actual physical product. And cruising has seen it every year. The growth in passengers has grown. The number of ships we're ordering has been growing. This year, we're scheduled 19 new ships to enter the market. And everything was pointing to another record year of earnings and revenue growth. Obviously, that all came to an abrupt halt back in March as for the first time ever, the entire industry ceased operations across the globe. Never experienced anything like that before. And currently we are still in that ceased operations phase. There are pockets of cruising taking place, primarily in Europe, for some of our international subsidiaries. And really where you're seeing that is in Germany and in Italy. Each one of us has a operational sub that's doing some work and really taking into account in their operations a lot of the new protocols we've developed. And so far it's been working, working with the local governments, port operators. So we're very hopeful that these are signs of that the protocols do work. And in addition, not just our protocols, but society as a whole is starting to adjust to, quote, the new normal. And we're hoping to see that continue to develop. In the meantime, everything is about liquidity, everything is about survival, and I'll get into that more during the panel discussion today.
Okay, great, thank you. Next up, we have Aurelio. If you want to introduce yourself. Oh, you're on mute.
Okay, can you hear me now?
Yes.
All right, I'm sorry. Aurelio Fernandez, President and CEO of Memorial Healthcare System. We're a safety net hospital system here in South Florida in Southern Broward County. I'd like to share with the group and the panel the experiences that we have had regarding COVID and the surge that took place in July and our part in South Florida to keep the area safe. But as a provider, we experience disproportionate number of admissions. But at the peak, 48% of all of our patients were COVID positive. That put a significant stress on the healthcare system. But it wasn't just Memorial that experienced that stress. All the hospitals here in South Florida. South Florida became the epicenter for the state of Florida when it came to COVID positive patients. If you think about it, we represent about a third of the population in the state, and we had over 50% of all the COVID positive. So there's a lot of attention done in the area to prevent the disease or the virus from spreading. One of the things that I found very interesting is that all the hospitals put the competitive environment aside and did what was right to maintain a safe environment and help each other. And that is unique in an industry. I have never seen it, and I've been in this industry 40 some odd years. And every week we would meet 3 times a week, all the CEOs from all the healthcare systems. Also, we would have Department of Health, we would have the Secretary of the Agency for Healthcare Administration participate. And how do we help the community? How do we go into the skilled nursing facilities to be able to prevent this the spread of the virus in these very vulnerable patients or residents that reside in nursing homes? Now, how do you do all this work and still maintain the flow of work that we're used to? You still have to have surgeries. Your emergency departments have to stay safe. We still have to do our transplants. So in this organization, we do adults and pediatric heart transplants and adults and pediatric kidney transplants. And that process has to continue. You cannot defer those services just because you have COVID in the air. So our main objective throughout the last 6 and 7 months was to keep a safe environment, specifically for our employees, the investment in protective equipment for the staff, taking the necessary steps that folks were not contagious, delivering the care that we all expect from our healthcare providers was a major challenge. We were very fortunate to have had access to manufacturers that were able to provide us with the supplies necessary, but it was a very expensive endeavor. There's, needless to say, the healthcare industry took a huge hit, not only my particular system, but throughout the state of Florida. We did receive care monies from the federal government that helped the process, but we continue to have a very, very selective level of care. All the hospitals in the state of Florida stopped doing elective surgeries and elective outpatient procedures. And that put a financial burden on everyone to maintain the cost. We were very fortunate in our organization that we did not have to rely on layoffs or furloughs. We did things accordingly, and we were able to preserve the workforce that is so used to the culture of the organization. So I hope to share with the panel and the audience the steps that were taken. It has been a huge experience. Just to let you know, right now, we're at 70% of where we were in mid-July when it comes to positive patients in our system. So that is the decline that we welcome. And just like our decline, the whole healthcare industry here in South Florida is experiencing the same decline. So Dara, back to you.
Okay, thank you. Always good to hear of the decline. Okay, Michael and Andrew, if you all want to introduce yourselves.
Everyone, how are you? I'm Andrew Falsetto. I'm the CEO of Ariat Hospitality Group, and I'm sitting with my business partner and chef and founder of Ariat Hospitality Group, Michael Beltran. We're a South Florida-based hospitality company. I'll address pre-COVID, so we can get into the details after, but we have 6 operations currently. Ariat Restaurant in Coconut Grove, Nave Restaurant, Coconut Grove, The Taurus, which is a bar and restaurant in Coconut Grove, Chubb's Cuban Diner, also in Coconut Grove. We have the Scapegoat Cocktail Bar in Miami Beach, and we have the Lenya, which was inside the Time Out Market, which was in the food hall. So with those operations, you know, we've been in our company started in 2013 in one form. We've been growing year over year. Pre-COVID, we had about 125 employees. We were running in the black in all of our locations. Since COVID occurred, you know, we've had to make significant changes and adjustments to our business model for the current time and in the future. We're down to about 35 employees at this point, all in different stages of adjustments. We have long-term plans right now, and we are, you know, it's been quite a challenging time for not just us, but everybody in our industry. But you know, with challenges comes opportunity, comes learning and improvement, and that's really what we've had to go through the last 6-7 months. And we hope 2021 is going to be a great year for us and a bounce back. Mike.
As Andrew said, I'm Michael Beltran. I'm the chef and I don't know, lots of titles for Ariat Hospitality Group. I guess one of the things I'll talk about more throughout this forum is the idea of business and community and how the hospitality industry has been affected through, you know, the several ways it's been affected through the coronavirus pandemic and the pivots and moves and survival that we really all kind of just adapted to throughout the last 7 months of our lives. So as Andrew mentioned, you know, we have 6 operations and things were, you know, it was a really good beginning of the year and it was a good ending of last year. And we were looking for, we were very much looking forward to this year. And now we're very much looking forward for the year to be over. But I think, you know, talking about business through community is a big thing for me. So, all right, that's it.
Okay, great. Well, thank you both. So I think Michael and Andrew will stay with you all. Before we move to our next question, I just want to let everyone know that if anyone viewing this has any questions that you have of our panelists, I encourage you all to ask those questions on the question and answer chat. But we'll continue with Michael and Andrew. Both of you alluded to some changes or pivots that you all have had to make as a result of COVID. So we'd like to hear about what those changes and pivots are. But before you answer that, I see that we have one of our polling questions up on the screen. So I just want to make sure that our viewers, our participants answer that polling question again to get the CPE credit. So everyone could just take a moment to answer the polling question. Okay. Okay, and okay, and with that, you know, Andrew, Michael, again, if you all can address, certainly your business was, you know, definitely an industry and a business that was 100% directly impacted by COVID. So tell us a little bit about what changes, what pivots you all have made in order to operate in a COVID world right now.
So obviously all of our businesses are different in a lot of regards, and they all have to be treated differently. It was one of probably the most challenging parts of early March, and then again in June, of where to go and what to do it. Michael and I are long-term planners. We try to think about what's best for now and the future, and the goal is to protecting every single one of our businesses. The first decision we made was Lenya, which was at the Time Out Market, which is a giant food hall. We simply just didn't see any future whatsoever, or any possible way that would be a viable business for many years to come, just due to the fact of it's a giant, about 400, 500 seat food hall with 16 stalls, which we are one of them. So we decided to walk away from that project, as we just didn't see a recovery anytime soon. We have on Miami Beach, we have talking about Scapegoat, which is a cocktail bar. That business, obviously, due to the fact that we do not sell food, we have been closed since March 17th. We are waiting for the opportunity to open bars again. We have a plan in place should we be able to. We have ideas to open bars that would be safe, but obviously there's only so much we can do until the regulations change and we're allowed to open. So that place stayed closed. We have Chubb's Cuban Diner, which has been opening outdoor only since the pandemic started. At one point, especially during the March when we were in full shutdown, Michael made a quick decision to actually change completely the concept and turn it into a grocery store. So to turn into a cafe, grocery store to provide people with essential services. At that time, grocery stores were a disaster. People couldn't get fruit, vegetables, bread, all those things. So Michael pulled the kitchen team together and said, let's try to provide some essential services. We did that for months, and then we returned back to the more traditional cafe diner that we've been operating. But it's currently a small space. So in the form of safety, we closed the indoor completely and operate almost as like a walk-up window, and we have an outdoor patio and we go there. But again, reduced staff, keeping it, but it's been operating since we never closed it. We have a restaurant bar called the Taurus that's been around for about 50 years that we purchased in 2013. It was more of a bar. It's a restaurant bar, but it was operating more as a bar. That we've been able to stay open and keep open, but we pivoted to a more food-focused operation in order to basically properly serve the community and serve a safer environment at the time, as bars are one of the most dangerous operations as far as people getting together. So we really made a conscious effort to change that into a more food-focused concept and put in high safety regulations. And we've had great success doing different pop-ups and creating really cool little food activations, which have worked well. Ariette is our flagship restaurant. That has been open throughout the entire time and has probably been our most successful operation. A lot of it due to a lot of our regulars, a lot of local support, community support. We've done well considering, and we've been able to maintain the strongest percentage of sales of any of our locations. Nave is our newest restaurant and our largest restaurant. It's a 150-seat restaurant. It's a seafood and pasta project. We were very, very successful in our first 6 months of opening. But post-closing, when we were reopening, it just was having such a large operation. In order to execute what we do really was a struggle. Just the large number of staff it requires to run the restaurant and so forth. So we made the decision in July to close it, operate takeout only for a few weeks. And then as we saw that people were starting to tire of takeout, we shifted and we started coming up with a pop-up, a weekend activation, which is more of a casual concept that we did on our patio only. So that's pretty much where we stand with our existing operations. And it's, like I said, it's been a challenge in each one, but each one, you know, all of our projects, the goal is long-term success and enduring all well into next year. And our plan has always been, let's be prepared to be in this until the summer of 2021. That's always been our thought process.
Great. It's definitely truly amazing and unique how you all have adjusted to the current environment and adjusted the operations of your business to meet the unique needs of the community right now. Moving now to Henry, obviously the cruise industry, there's a lot more restrictions as far as how you all are able or not able to operate in the current environment. So tell us what changes or pivots you all have made in anticipation of the time when we'll be able to get back to cruising.
Yeah, it's been quite a journey for us. It doesn't feel like 6 months. It kind of feels like 6 years, kind of like what Michael said earlier, that just waiting for this year to be over and get to a better place. You know, we've dealt with issues in the past, incidents that have been more one-off on a specific ship or say a region because of a hurricane, even, you know, 9/11 and the global recession, but nothing ever at this scale, scope, where it's impacted not just our industry, but every industry, every part of our value chain, including our guests or travel agents, you name it. It's just been overwhelming at first. So priority has always been in our industry, the health and safety of our guests and crew. It became even more so in the early stages. So all attention, every pivot went toward how do we get them back. And the biggest challenges there have been really working with government agencies, local regulators, ports, that really weren't sure how to handle the situation either, and continues to evolve even to this day. Adding to that, just the logistical nightmare of just taking crew, for example. We have hundreds of thousands of crew aboard almost 300 ships across the globe in our industry, and the crew come from over 135 different countries. Each one of those countries has their own view on how this is going to work, whether they're allowed to come back, how they're going to come back, where they're going to go when they come back. Then you tackle on the airlines and the hotels and transportation that we're all shutting down, having to find charters. Everything was just a huge challenge, but that's where all our focus was at the beginning. And at the same time, liquidity became very much an everyday conversation almost every minute, all while things were evolving in our landscape. On the liquidity front, everything has been around watching every single dollar that goes out the door, trying to reduce our cash burn, trying to create new places where we can access liquidity. I think one of the benefits we had as an industry heading into this is that historically we've enjoyed very low cost financing without having to secure any of our assets. That ended up being a huge benefit in this environment because now we had all of this unencumbered assets that we could use to collateralize a lot of the financing that otherwise either would not be available to us in this environment or would be available at extraordinary interest rates. So the whole industry has been able to leverage that with our ships. That's been a huge benefit for us. I think the other piece has been partnering with our supply chain, our value chain, especially the shipyards and our banks. Over the years, we've had a very solid relationship with both parties, shipyards and banks, in getting a lot of our growth, getting a lot of our ships built. And that's been huge during this time period in order to either defer payments, suspend covenants, and really working together as a group to make sure this industry didn't fall apart in a period that everyone believes is going to be temporary, and we still believe that. So that's been huge for us to try to get through this. Now the other piece has been, we've been working on this probably since the beginning, developing a set of protocols in how we're going to operate going forward. A lot of it, fortunately, as an industry, we have experience with when you come on board, washing your hands, hand sanitizer, cleaning all high touch points. If you've ever been on a cruise, especially over the last few years, that's always been there. Obviously now it's on steroids as far as social distancing and coming up with how is this going to work. Having to rethink the total guest experience from the moment they come on board to when they leave. So there's a lot of focus on that. We've had to bring in experts from across the medical science community. Every one of the players in the industry has done that. So we're working with them. We're working with the CDC. That's been really challenging. Some more frustrated than others about how slow this process is taking. And we get it, you know, there's a lot of unknowns. People are learning something new about this virus with every day that goes by. But with every day that goes by, it's costing an incredible amount of money to the industry, to people who work. Back on the liquidity front, unfortunately, we've had to do layoffs, we've had to do furloughs. But we did that as basically a last resort. We cut back everything else that we could at the risk of prolonging some of the growth strategies that we had. So that's kind of where we're at right now. I think really what we're doing is trying to show and demonstrate that the protocols we put together will work. And we're really looking for that day that when we can start operating.
Great. I know everyone's looking forward to that day as well. Thank you. Before we move to Aurelio, we do have another polling question up for all of the participants. So if everyone can make sure they respond to the polling question to get the CPE or CLE credit. Okay. And now, Aurelio, if you can talk to us and tell us a little bit about how your hospital and how the healthcare industry overall has had to change and pivot as a result of COVID. Certainly, this has obviously had a major impact on the healthcare industry overall and changed your business model going forward. So if you can just briefly talk to us about what those changes have been for your hospital.
It's interesting to hear how we have adjusted as a business. You know, you hear Henry and then you hear Andrew and Michael, and we all had to adjust. And I see this not going away necessarily soon. We are hoping that Labor Day weekend will not result in another surge, simply because I think we're much smarter now. We're adjusting to social distancing, or at least abiding by CDC guidelines. But fundamentally, the whole healthcare industry has changed. We're going from an area where you had a lot of elective work to one that is now more selective to avoid having patients come in that might be able to defer. I can say that, for example, the biggest challenge is no visitors. We still do not have visitors going to our facilities to prevent community acquired the spread of virus. That's the major element of the spread. I mean, we had, at least in our market, the collaboration of elected officials that set forth ordinance that precluded individuals from gathering and not wearing setting fines if they were not wearing face masks. And I love to hear what Andrew and Mike were saying, that them as business folks were making sure that they were abiding by those CDC guidelines, because another closure from whether it be the governor or local elected officials would have been catastrophic from a business perspective. So the other thing is that you have a limited number of bed capacity. So we had to convert auditoriums, conference centers into patient rooms. And even though they were temporary, you had to make it into a safe environment. We converted rooms to what is referred to as negative pressure rooms, which means that all the air goes out the building to prevent it from recirculating into the hospital. So let's say that you have capacity for 130 critical care beds, and all of a sudden you're hitting 180, 190. Where are these patients going to? So it was a real challenge, and it took the collaboration of everyone in the front lines to give us ideas in how do we go about delivering care without spreading the virus, not only to the employees, but also to other patients. And we were very, very fortunate to do so. You have, for example, setting up tents, temporary tents by the emergency department, so folks can go in there and have the preliminary checkup in these tents instead of coming into the physical plant for their testing procedures. Outpatient surgeries were put on hold as well, and we're still very selective as to what is it that we're currently doing. One of the areas that I find that is going to be here with us for forever, I think this has really revolutionized healthcare, and this is the venue that we're using today, and that is using technology to deliver healthcare. Telehealth has just gone through the roof. If I can just share with you, we were doing 100, 200 consults a month. We have done over 117,000 consultations using telemedicine without having the consumer having to get in the car, going into a medical office building or going into an outpatient surgery. So I believe that this is a permanent change in our industry, and it is going to benefit by improving access, reducing the potential of contamination. So telehealth to me is one of the, again, revolutionary opportunities for everyone in the industry, at least in my industry. I mean, you can't do that in a restaurant or in a cruise ship, but definitely in our industry, it's something to be, we're looking forward to. From a financial perspective, as Henry alluded to, we did secure a line of credit for $125 million to make sure we had adequate cash flow to meet our needs. We did invest heavily in inventory to make sure that if this happens again, there's adequate supplies so that we are not faced with gouging in the market, which took place, by the way, the 300, 400% increase in the number and the amount of cost for PPEs, which was very frustrating, but we had no supplies. If you remember, PPEs were coming from China, and all of a sudden that particular network closed. So a lot of folks were being creative. Some folks were re-sterilizing N95s, and fortunately we did not have to go to that extreme, but you were assigning PPEs to individuals to make sure that we preserve the burn rate that we would have in our inventory. But we have higher inventory now. We have, like I said earlier, the telehealth access. We converted rooms into negative pressure rooms to expand our capacity for critical care. For example, back in March, when this whole pandemic started, the ventilators was the equipment of choice by everyone. And then there was the high flow conversion. And I know this is all technical, but it was the availability of high flow was much more available than, let's say, ventilators. And if you remember seeing on television in New York where GM and Ford converted their assembly lines to produce ventilators, that's no longer a major issue in the healthcare industry. So we have come a long ways to learn what to do and not to do. We just got to continue to be careful, because another surge like we experienced in July is going to be devastating for providers like ourselves. The physical exhaustion of nurses and physicians cannot be underestimated. So hopefully we should know in about a week or two from now how we all did as educated residents in abiding by the guidelines, CDC guidelines on social distancing as well as wearing masks.
Great. Thank you. I mean, certainly, as you mentioned, the pandemic has had a permanent effect on the future of all the industries represented on this panel. Before I move to my next question, I want to make sure that I'm addressing some of the questions that our participants are asking. So one question, and I also have that question on my list as well. But one question that our participants have asked is with regard to any of the federal and local incentive federal programs like PPP programs, other local incentive programs that have been introduced. So if Michael and Andrew, if you all can start and let us know, have you all been able to take advantage of some of these programs, and also let us know how accessible these programs have been for you all, and how much support from the business community you've received in order to apply these incentives to your business?
Well, as a company, I would say that we're very fortunate. Despite, I would call ourselves a family-run business, we are essentially a self-funded business of simply friends, a close group of friends, and a small group of partners who have very strong financial backgrounds. So when all the federal loan programs came out, we were able to jump on them fairly quickly. We got PPP loans for all of our businesses. We applied and received SBA loans for all of our businesses. We Michael worked with some people, and we got other basically, which were employee-based loans, which are basically direct payments to employees. For those things, we did, for us, again, my background, I'm a CPA myself, and I have several partners that are CPAs as well. So we worked immediately on these projects and worked with our banks and worked with our accountant, with our accounting firm as well. And we were able to navigate it quite well. Again, we're lucky, we understand these things. A lot of people in our industry do not understand these things. The PPP loans were great, but a lot of people in our industry were terrified by them with this. This is converting into a loan and you have to hire everybody back. And so that, we obviously realized that, this money was needed to basically provide for employees. But in addition, this money is also, we may need longer. If you can't open and you hire a bunch of employees, and this is what, and again, the PPP loans were for all industry, and they were a blanket, but not every industry is going to react the exact same way. So for us, when you can't open and you have money to pay employees, if you just pay all your employees, you're broke again in a couple months. So obviously, we were there. We helped as many people in our industry as we could. We tried to give them some advice. But for us, we handled it, I think, quite well and efficiently. I found they worked well as far as I think they did the best they could to make them work for as many people as possible. But like I said, for people with a financial background, it's a lot easier to work through all the details and understand what they're for, what it works, consequences, what a loan would mean to you, and so forth. So I think on our side, they worked well. We were able to get everything that we applied for, and we tried to use them to the best of our ability. And like I said, we did some self programs where, we basically donated portions of sales to employees. We understood the spirit of a lot of these things were to get money back to people and employees. And there's so many people in our industry are unemployed. So really the goal was to try and get these people as much money as we could. without closing our doors. So that was kind of the balance that we had to play. So that's pretty much how it worked with us.
Okay, great. Well, that's good to hear that you all were in the right position to be able to utilize those programs that were put out there, especially in your industry. But before we move on, we have one polling question up for our attendees. So if everyone wants to make sure they answer that polling question. And then moving on, just to, with regard to the same question, Henry, was your business, was the cruise industry able to take advantage or utilize some of the federal and local incentive programs that were out there?
So in the U.S., the answer there was basically no. We were not, although we're headquartered here, we operate in international waters. So a lot of these programs really were not available to us, or any of them. But what we were seeing was support and assistance in some of the countries where we have a huge presence, either through having operating subsidiaries there, or where we actually construct our ships. So probably from something similar to the US, what we saw was in the UK, they did offer a commercial paper program that many of us in the industry took advantage of to help us. It's a one-year program. So that was of help to us. But probably the biggest source of support came from those countries where our shipyards are located. Those are also the same countries where we obtained the financing to build a lot of the ships. So really early on in this crisis, the group got together as far as the industry, the banks, the shipyards, and realized the severity of the issue and worked out basically restructurings of the debt to allow to defer payments into the future. The shipyards themselves were having issues. They were having to close down for months. So they were looking for some relief from us as far as what they were building, when they had to deliver. So we worked out plans to defer some of the work, not canceling anything. I think that was really the critical part here, is that no one, the governments, the banks, shipyards, and ourselves, nobody wanted to see things just disappear, orders to go away, but more of a timeout, a pause, a deferral to get through the current crisis that we were in. So that was pretty huge for us, and continues to be. We continue to work with them. They in turn have suspended covenants as well. So that's been really big. The other source for us has been our supply chain vendors. They've been extremely supportive through all this. So in ways of either delaying payment terms, some have gone really above and over and above what we needed. Also providing discounts. There's some vendors that they were there to deliver product that we still needed, but were willing to wait until we started operating in order to receive payment. So things like that have been huge. And again, goes back to a lot of the strong relationships we had built prior to the crisis. That's allowed us to really leverage all of our different vendors. So really because a lot of this wasn't available to us, we've been really forced to find ways through our supply chain, through our vendors, through our banks, our shipyards, to create liquidity, access liquidity, and then as well as just watching everything we're doing. So not much in the way in the government, direct funding or sponsorship, but more on our vendors and support from our partnerships.
Okay, I mean, I think that's very impactful to hear that although you all weren't able to capitalize on those federal incentive programs, that you, along with all of your business partners, were able to come together and think of the pandemic as just a deferral of the future business, as opposed to putting an immediate halt, and that you all were able to work together to ensure that the business will continue on post-pandemic. That's great.
And that's been key, really. I think everybody realized at the beginning and continues to see this as as a timeout, right? Really a temporary, huge blip, but a blip nonetheless in the grand scheme of things, and looking forward to when we can start operating again.
Sure, absolutely, absolutely. And Aurelia, what about you? Certainly the pandemic has not paused or deferred your business operations, but have there been any aspects of the federal or local incentive programs that your hospital or healthcare has been able to capitalize on?
Absolutely. And through the care funds, the federal government has been very generous with the healthcare industry. Here in the state of Florida, we also have a governor who has been very responsive to the needs of healthcare providers. So the ability to influence the direction of federal funds to all the providers was significant. Fortunately, we have not had to tap into a lot of those funds. We did have a very strong, we still do have a very strong balance sheet. As I said earlier, we did secure a line of credit, which we have not had to tap into as well. So we have been self-sufficient thus far, but the federal government has been generous with all healthcare, especially the hospital industry. As to what the community has done, you can see how folks, especially the restaurant industry, they would provide and donate lunches for all the employees in particular hospitals. Companies that are non-healthcare providers were able to secure PPEs like face masks and gowns, and they would donate them to our hospital. So I found really a concerted effort by the business community to help and listen what was going on. It was just an amazing and outflow of support. As Henry said, the supply chains also helped, and simply because they wanted to make sure that we had ample inventory to care for our patients. But they were also challenged because the supply chain or their networks were not able to secure their own supplies to be able to distribute to providers. So that was a challenge. But I was so impressed with the way that the business community, from all aspects, large employers, small employers, young people, older people, it just came together and say, how can we help? I know your staff is working around the clock. Let's send some meals. It was just a terrific force of coming together in a community. And the local market, the local governments did not impact from a financial perspective as providers. They served more of a communication tool to make sure that we understand the importance of abiding by CDC guidelines. I think that's where the governmental influence at the local level came in and helped us, because we have seen, there's no question in our minds that the decline in the number of positive admissions to our hospitals is a result of residents abiding by CDC guidelines. So that has to continue. So the federal government was generous. The state of Florida was very responsive, and the business community really stepped up and gave us an awful lot of assistance when we couldn't find PPEs out there, as well as feeding the staff.
Okay, great. Yes, I certainly echo your comment that I think it was truly remarkable just how the community came together to support our first responders, the healthcare industry, and local businesses as a whole. Now, before I move on with my next question, I want to make sure I address some of the questions that some of our participants are asking. So one question that's come up directed towards Michael and Andrew is whether or not you all have given any consideration to going forward. Will the restaurant industry address any potential liability issues that could arise as a result of a patron making a claim that perhaps they got COVID as a result of the restaurant or bar reopening. So what are your plans to address any future liability issues that might arise as a result of COVID?
Well, I think as far as liability goes, I think it's pretty clear what the regulations are for restaurant openings. There is a very clear outline from the city and from the cities, the county, the state, what we're supposed to be doing. If we abide by those guidelines, and we are responsible vendors, we don't have a ton of concern. If somebody, again, people can sue for anything or people can come after you for anything. But the truth of the matter is, we have had 0 COVID cases within our staff. We test everybody. We are very strict about our guidelines. You don't have a business right now if people don't feel that they're safe coming to your restaurant. That applies to right now. That also applies to in 6 months.
I mean, the one thing we talk about at length is, our number one concern is our staff, and then our, equally is our guests. People feeling safe, people feeling like when they come here, they can be comfortable in their setting. And I think that's really what set us apart from a lot of places, is that we wanted to be at the forefront of that. And that was something that we worked on, and we continue to work on and tweak every single day, because I think the situation changes every single day. And as kind of situation evolves and government state guidelines change, whether you can open indoors at 50% or 25% or whatever, the number one concern is always going to be safety. So even if they say we can open at 100%, you could sit people on top of each other. If we don't feel like that's the right move and we don't feel like it's going to keep our staff safe and our patrons safe, we won't do it. And that's really the stance that we've taken since day one.
Great. And our next question is directed towards Henry. Henry, when do you foresee the vacational cruise industry expected to come back? And are you expecting it to come back to the level pre-pandemic? When do you and others in your industry foresee that comeback happening?
Well, that's the million-dollar question. And it all starts with, when will they allow us to actually start the process, right? I think that's still very much up in the air. We're working closely with the CDC, and as I mentioned before, we all have our panel of experts that are really working through this and sharing information, not just with the industry, cruise industry, but in general to the public of what we want to do. But once it starts, I think all of us expect this to be somewhat of a gradual return. No one wants to just turn. This is not going to be a light switch, right? And I don't think nobody wants it to be that way either. Only because we want to be measured, we want to be careful. What we don't want to do is take one step forward and then 5 steps back, right? That's not good for anybody, and especially the image of the industry. So everyone is extremely careful about that. Touching on what Andrew just said and Michael, that we don't want to go out there and create an unsafe environment for anybody. So until we feel and others feel that the time is right and we have all the protocols in place, that probably won't happen. We do feel we're getting there. We're getting close to that point. But once we do, I think it will be a gradual return, and a lot of it is also dependent on the different ports, countries, when they feel comfortable as well. So I would expect, just like what we're seeing in Europe right now, itineraries are very limited. They're short duration. They start with like cruises to nowhere, and then gradually what you're seeing is they're opening up different ports and itineraries. I foresee the same thing happening in this market here. The good news is there is demand. We know from our loyalty guests, we know that from just talking to people on the street, people are ready, they want to cruise. Some are ready regardless of the safety protocols, which we appreciate that. Others are more measured and want to see how this evolves. So I think this will be a gradual return, but it will get there eventually.
Great, great. And next question is for all of our panelists, but we'll start with Aurelio. Talk to us a little bit about what the future looks like. How has COVID permanently impacted your business going forward? And certainly, hopefully, we'll see an end in the near future to COVID, but certainly the effects of COVID and how your businesses have had to adjust will have permanent repercussions. So to talk to us a little bit about what the future of healthcare looks like for you, Aurelio.
Sure, and it's going to be a gradual change. It's going to be a long-term recovery. I see COVID staying with us for quite a while until we find a vaccine. So the changes that are being made is that you need to adjust your delivery, your healthcare system to be able to have isolation space in much greater numbers that you were used in the past. When you're onboarding staff, you're educating staff to avoid contamination and from a variety of ways. And it's just not the clinicians. How about the housekeeper that goes into a room, or the dietitian who delivers the food tray? Everyone needs to know the do's and don'ts in a new environment. We as an industry are projecting a surge because of Labor Day weekend. I am not of the opinion that it'll be a great surge. Yes, there'll be a spike. And the reason is for the same things that you heard Mike and Andrew and Henry. We are all now much more vigilant. We're taking precautionary steps to avoid inappropriate behavior. That did not happen in Memorial Day weekend and the 4th of July. It was a free-for-all. So the fact that we're now adhering will maintain, hopefully, this is my opinion only, I'm not a scientist, but hopefully will maintain the number of patients being admitted. What is driving the state's decision to be more lax, if I may use that word, is the fact that hospital admissions for COVID has declined significantly, but testing is still continues, and there's positive individuals that show up positive, but they do not require admissions to the hospital. And if we can keep on that trend, whether it be because they're younger folks, whether because we are being much more vigilant, I do not know what it is, but admissions are going down. But as an industry, the change, the most fundamental change that I mentioned a little while ago is the use of technology and telehealth. And the consumer now feels comfortable being talking to a physician over a screen and being evaluated. And there's an awful lot of technologies there that can be used that can actually do an exam remotely. You don't have to go and see a physician's office. I mean, yes, we all know the first visit has to happen on a face-to-face basis, but the follow-up visits, there's technologies out there that can do your blood pressures, your heartbeats, how about your earaches, everything can be done remotely. So as an industry, we, at least our organization, is redirecting a lot of the capital dollars that we had set out for bricks and mortar and redirect them into technology-based to improve our platforms, to avoid disruption when you're conducting a consultation, making sure that your scheduling process is automated, that you avoid cancellations. So technology is going to drive the way that we deliver healthcare in the future, more so than we had ever imagined. I mean, it's unfortunate that it took COVID to energize the industry, but that's what has happened. And it's going to be gradual. We're not going to see the numbers we saw before. Our emergency room visits are down 30%. If you look at our pediatric emergency room visits, they're down over 60% over prior year. Now that could be also because schools are still using e-learning and they're not opening. In our county, they're looking at opening in October. You also do not have high school sports, which also prevents the contact between students. So that could be contributing factor to the lower number of, a slower number of ER visits in all of our facilities. But gradually, folks will start coming back, but it's going to be a long journey. I don't see this happening overnight.
Okay, thank you. Well, we have another polling question that has come up. So if everyone makes sure they answer that for their credit. Just one aspect that you mentioned, Aurelio, is that, which I agree with, which if there is any bright side or positive aspect that's come out of COVID and the pandemic, it's that businesses in virtually every industry have had to accelerate innovation in terms of processes and technologies, a lot quicker than they would have had to without COVID and without a pandemic. So if there's any bright side or positive attribute that's come out of this, certainly it's that. Now switching to Michael and Andrew, certainly in your industry, the future has certainly changed on a permanent basis as a result of COVID. So talk to us a little in terms of how COVID has permanently impacted the future of the restaurant and hospitality industry.
Yeah, I'll start just kind of talking about a little bit about the business side and where we feel it's going to go, and then I'll let Mike talk a little bit about what it actually means to a dining experience and what dining or bar or any type of hospitality experience. Obviously, for us, like I was saying earlier, we are firm believers in the industry bouncing back. Obviously this is a very difficult time for everybody, but we feel that our industry in its best is the place where people enjoy themselves, come together, have special moments, all these things. I think people are desperately missing that. This has had a huge, a huge mental toll on a lot of people, and they're still going through that. We had one of our key staff members commit suicide, during this pandemic, which is really out of nowhere, and it showed us a little bit about how difficult it is for a lot of people. Social interaction, we're used to that. We don't have that right now. So we feel that our industry, will provide some healing. And with that, once people feel safe and once we're in a safer environment, we're going to have a great opportunity to recover. And it may take a while. We're not expecting a grand recovery. We think, again, we always say summer of next year is when we could potentially see a real recovery in our industry, at least. And for us, right now our current plans are, and everything changes. We're waiting to reopen our bar that hasn't been open since March. We're anticipating some time before the end of the year. We're anticipating reopening our largest restaurant before the end of the year. We're actually in the process of closing our diner, but then renovating it and reopening next year. We are actually opening 4 new locations next year. So we're actually going to be in a rapid growth phase after this. That's kind of been the plan. We worked really hard for a long time to get to the place we're at right now. And we truly believe that, once we get through this, that we are going to be in a growth phase. And I think the hospitality industry will recover, but it's going to be tough. We've got a long way to go, but we're firm believers in our industry. We think we're going to be part of the solution for people to start enjoy themselves, to go back to, like I said, social interactions, bars and restaurants. It's what a lot of people love to do on a daily basis or a weekly basis or a monthly basis. But we want to be there and we want to be ready. And I think that during this time, it will be different. People are going to want different things coming out of this. But I think the one thing that Michael can elaborate on is that, one thing this is given us the time, instead of just running around and like chickens with our heads cut off. We've been working hard at becoming better. Our staff has gotten closer. We as a team have gotten stronger. and we've been working on every single aspect of the business to be as great as we can be whenever we're allowed to be. So I can.
Yeah, I mean, I think the hospitality industry has several tiers of the style of dining or the style of service. You know, you have fast casual, you have fast food, you have upscale casual, you have super fine dining, you have ghost kitchens, you have so many different things. I think the one thing that is very true is that there will be people that are going to lean heavily towards maybe a faster casual dining, like style of dining, and that may be the direction that they go because they believe that's maybe a key to the future. We don't feel the same way. We feel like the world of food and beverage is kind of like a safe haven for people to feel normal again and to enjoy themselves and to kind of, you know, connect with family or connect with whatever it may be. We believe in that aspect, and we believe that that will still be here in the future. So like Andrew was saying, we do plan on expanding in the future, and we plan on continuing to build that community aspect that we do through food and beverage. And I think that we have used this time to kind of reflect on what the business was before and what it will be in the future. And, you know, we have ended up being better, I think, on the other side of this in comparison to how we operate our business and how we went to the foundation, we fortified the foundation of our business, and then we started to build it back up again, even though it's going to be a slower building process. I feel like being patient, especially right now, is very important. And there's several ways of rebuilding that foundation, whether it's through community, through connecting with your staff and building a better relationship and understanding how to work with your staff better, or just foundationary business sense of, you know, how do you work with, you know, recreating your new budgets, recreating your new systems, recreating all those things, because we are going to be in a different climate now for the foreseeable future. Well, is there an end in sight? I mean, I don't know, but you know, it's going to be there one day. So I think food and beverage is going to change. The essence of what food and beverage is not going to change, but it will change. How it'll change completely, we don't know. We're just trying to prepare ourselves for any, you know, all aspects and all things.
Thank you. Okay, Henry, if you can address what the future of the cruise industry looks like. Certainly, I don't know if we'll see many midnight buffets on the cruises going forward, but also as you address the future of the cruise industry, if you could also address a question from one of our participants with regard to how closely are you monitoring the airlines and the hotel industry to understand their journey? So when the cruise industry does reopen, you might use insights gained from the hotel and the airlines to, you know, to benefit the cruise industry once it's able to open up.
Sure. So I'll take the second part first. So we definitely look at those industries as sort of not just indicators for how this is going to evolve, but they're also very important in our value chain, especially when it comes to transporting guests to certain locations in order to take the cruise. There's a lot of our guests that do pre and post activities before they get on the cruise and after. So there really is somewhat a symbiotic relationship among all of us in this space, just as well as the restaurants, everything, right, really kind of comes into play. But we do monitor them not just to see what they're doing, but also to see what the availability is, especially the air industry. So that's definitely something we're looking at. As far as the experiences they're having, what they're going through, it's very similar to what we're seeing. Big difference, obviously, is they're operating. We're hoping to get there as quickly as we can, but we are monitoring that. As far as what this means to our industry going forward, you know, I think similar to what Michael and Andrew just touched on, we believe the experience that cruising offers, which is a little bit of whether it's a dining experience or a hotel stay or just visiting new places. It's really about getting people together. It's really about whether it's with your spouse, whether it's with your children, whether it's with multi-generational gatherings. That's really what cruising is at the heart. That's what it's all about. And we believe that will be a desired experience for millions of people going forward. The issue is how we deliver that and how we manage our business going forward. I think the impacts will range as far as longer term versus shorter term. Going back to mentioning these protocols we're developing, that will essentially impact every area of the cruise experience, from before you even board to when you're at the pier to when you're on board the ship to when you're at a destination. Though all of those things are being developed, I think the questions we're asking ourselves is, once those protocols are approved, well, when do you scale those back? When do you reinstitute them? What are some that will never leave, right? I think we look back, those of us that can remember what air travel was like before 9/11 versus what it is today. There may be facets of our experience that will now become normal-place, right? As far as before you board, when you're on the ship. Those are things that we'll see how they evolve, but we'll also, we're looking to outside regulators and advisors to let us know also what they think as far as the timing of some of these measures as to when you roll them out and when you scale them back. The challenge for us will be balancing all of that while still delivering amazing vacations, right? But again, safety and health will continue to be a priority for us. We're lucky in that a lot of the investments we've made over the last several years will help us quite a bit going forward, although we didn't see it at the time. So for instance, we made significant improvements to our digital infrastructure on board our ships, as well as before boarding the ship. That's going to be huge when it comes to having touchless or contactless boarding procedures, as well as ordering product on board our ship. A lot of that now can be done through mobile devices. That is very helpful. A lot of the developments we've made in our private islands, most recently last year, we opened up one. At the time, huge for us, revenue source, added another facet to our cruising experience. But going forward, especially in the short term, it's going to be huge because you're able to really have a controlled environment, easier for contact tracing, easier for handling issues when you have private destinations like that. So I think that's really helping our industry quite a bit. And it's not just Royal. All of us have these types of, and have made these investments over the years. So I think that'll be really big. Soon, though, as an industry, I think a lot of us have been having these conversations, but there's going to be a pivot toward how do we regain our financial health. Obviously, a big piece of it is demand and getting the consumer back and managing that demand. That will always be a facet. But there's another piece of it, which is how do we continue to monitor costs? How do we get out of some of the debt we've had to take on that is much more expensive than what we're used to? So that will be a huge journey for us. I think someone said earlier in our process that you never let a good crisis go to waste. And when this came up, it really forced us to kind of put a clean sheet of paper out as far as how do we want to operate, especially when it comes to back office type activities. So things such as automation, things such as outsourcing. We're taking a look at all of that, and we're able to do that now probably more than before because there's a timeout, there's a pause in operations. You're not trying to change the engine while the car is running, the car is parked. So what can you do to really enhance the performance of the company, both not just to get out of the current situation you're in, but get back to a strong, healthy financial return. And then lastly, probably one of the areas that at least I didn't have a lot of personal experience was working remotely. That has been a rather big change for me and for many of us. And not just using the technology, but engaging with our workforce, engaging with our employees. That has been, somewhat of a challenge over the last 6 months. I, for one, like the constant contact with people in the office, the collaboration you have face to face. Pivoting to this world has been somewhat unusual, and I can see that being something we do more into the future as far as back of office, but it will come with making sure our employees are engaged, that they feel they're connected, and communication constantly is a big part of that.
Thank you. Another for the participants? Okay, Michael and Andrew, Henry and Aurelio have alluded to and mentioned some of the technologies that they've adapted to and maybe accelerated as a result of COVID. The telehealth, the automation, the touchless check-in that Henry mentioned. Have you all in the restaurant industry been able to accelerate or take advantage of any of the technologies that are out there that could be beneficial for you all in a COVID world?
We've seen a good amount of things change from a technology standpoint. I think it's more the use of like third-party delivery services and how that has really skyrocketed, even though us personally, we don't partake in that. We do our own delivery. We've seen a lot of like the QR code menu things, but there hasn't been much in the world of like technology when it comes to food. You know, people still need to physically eat the food. So it's really more how they consume knowledge about your restaurant or consume knowledge about your program, whether it be delivery or, you know, how social media has changed things. Like for a long time during the actual quarantine, when we turned one of our outlets into a supermarket, we did, you know, fresh meals every day, you know, prepared meals for people to take home. We would change that menu every day. We would send that out every day. We would send emails every week about things that we were doing, a Friday special or whatever it may be. There hasn't been anything in the world of like actual, I think, technology, but it's been more of like the delivery of information has been that we had to be more aggressive and we had to be more on top of how we communicate with our guests and how often we do that and how we get them that information changed dramatically in comparison to before. Before, people would come to the restaurant, they would find out what was on the menu or what you were doing that week or whatever it is. But now we had to be even more aggressive with the use of like social media, with emailing and so on and so forth.
I think also just, you know, just on a quick point, you know, what makes a restaurant special in general is the experience that you have there. And unfortunately, technology, you know, if you were to replace a hostess with a machine that will tell you where to sit and so forth, that's not what people are going to want. At least I don't believe it. It's part of your experience in going to a restaurant. You know, you want to sit down and talk to the bartender. You want to see your favorite, you know, your favorite manager or your favorite waiter. You want to talk to the chef if you have a chance. You want to talk to other guests. You want to socialize, you know, like that type of thing. I think unless you're in a fast casual or fast food concept, technology will assist and advance it and make it better. I think anything outside of that, it will take away the experience. I think, in fact, it would hurt the business to go in that direction. I think people need to feel safe to come to restaurants, and our business will recover when people feel completely safe, and only at that time. And technology are changing those things is simply, right now you have the people that feel comfortable to go out for dinner, they're going to go out. The people that are not comfortable going out yet, you can put all the equipment up you want, they're staying home. And that won't change until everybody or the vast majority of people feel very, very safe.
Yeah.
Yeah, no, certainly that's an excellent point. Staying with Michael and Andrew, a question that's been raised is, you know, as guidance comes out frequently, it changes on a daily basis to where, you know, there's new facts that come out every day as part of our new normal. So where are you all finding the most reliable source of information for, the foundation for your decision making? Who or, what publications or sources are you all relying on to make these decisions?
Man.
Yeah, well, it's really, unfortunately, as a business, as a citizen, finding it's conflicting information all the time. So you really don't know what's real or what's not. So, for example, every single day at about 2 o'clock, I go on the Miami-Dade County website, I check the new normal, I look at hospitalization rates, I look at, positive test rates, I study all that on my own. Chef and I communicate about that every single day. What do we think is going to happen? We try to get as much data as we can possible. We have our business partners and stuff that communicate with us, our staff, and we try to basically put it all as we can together. But we've also taken the approach back in July, when things were really, or late June, early July, when things were really kind of there, we decided, forget about what we're being told what to do. What should we do? And we're going to decide, which means being on the safer side of everything. And we are going to basically stop service here. We are going to space tables as we deem fit, which is if it's 10 feet apart, like our bar, we could have sat people inside for months. We never opened the inside of the bar. We just it's a smaller bar. Well, the restaurant bar, the Taurus, the inside, which is the bar part, is a small space. So we're like, yeah, you guys can open inside at 50%. We're like, we're not doing it. We're just sitting outside. And guess what come up? You can only sit outside. So, we made these decisions on our own because, again, right now it's following regulations. Let's just be as safe as possible. The best case scenario right now is we become, a county or a state that has very little virus transmission going on, and people are starting to be safe and we can open up and all that stuff like that. Until then, let's be careful. Let's do our part. The faster this is over, whenever that is, the quicker we can recover. So,
I think kind of what you mentioned before was just because they tell you that you can doesn't mean that you should. And I think that that's important for every business owner to consume that knowledge and understand it, because if you can open at 50% indoors, doesn't mean that you should. It all depends on what your space is, the style of service that you have, the kind of restaurant that you are, the services that you offer. I mean, a lot of that, our cafe diner that's down the street, I mean, we could open indoors, but we didn't, and we're not gonna, because it's too small. So it's the same thing like what Andrew mentioned about Taurus. But a lot of times people lose sight about the health of the business long term, and they just think about the business today. And I think that's oftentimes where people fail, because you're not game planning for today, you're game planning for long term. So next year, the health of your business throughout this whole thing. And, people always want to think about the now and they don't think about the future. And I think that's a problem.
That's an important point. Thank you. Aurelio, what about you? What sources of information or data are you relying on in order to dictate the operations of the hospital?
Well, before I go there, I want to really commend Andrew and Michael for what they're doing, because as small business folks, it's not easy to take the social responsibility that they're taking. And that's why I believe that the surge as a result of Labor Day might not be as high as some folks think it is. So kudos to you. And you're right, you're going to be successful because you're being proactive. A source of information, we use a variety: federal data, state data, county data. We look at it every day. We monitor the trend lines. Even though, just like what Mike and Andrew said, right now the state has allowed for hospitals to have visitors that go in, and nursing homes. We as an organization have made a decision not to. So we are opting out to be in a safer environment for everyone's sake. But the trend lines are very important because it just gives us an indicator and plan. For example, we brought in almost 300 travel nurses to complement the staff during the peak in July. The trend lines indicate that the utilization of positive COVID has declined to the extent that I am now in a situation where I can decide, well, 50% can go back, or 60% or 70%. The state data is the one that we use most closely because we all, as a hospital industry, submit data on a daily basis to the state on admissions, how many patients in critical care, how many patients in vents, what are the discharges, what's the mortality rate, and do we see pockets? Do we monitor what's going on with nursing homes? And that data is at the state level. So we're very, very close to the Agency for Healthcare Administration in securing information that will give us at least a projection as to where we're headed. You know, this is not a precise science. A lot of variables are in place. You can have a cluster all of a sudden in one of the hospitals or in one unit where you have to close the unit, and then you have to quarantine the staff that work in that unit for 2 weeks. So we're very vigilant when it comes to data, and we're data driven, but we're still flexible, understanding that the interaction that we have between ourselves, patients, and the community could influence those projected trends that we rely on.
Okay, thank you. We have another polling question that is up. So if everyone can make sure they answer that for their credit. Okay, Henry, what about you? What sources of data or information are you relying on to make business decisions in your industry?
Well, early on, we formed task groups within the organization from different disciplines. They're really just gathering information from every place we can get as far as what is happening, what the trends have been, and not just here in the US, although that's our largest market, but really pretty much across the globe, just to make sure we know what's going on. That same group has then in turn developed protocols or actions that we should be taking once we start operating. We felt pretty good about those actions based on a lot of the research we've done, including our own experiences to how to operate a cruise ship. But we felt important enough that we brought in a panel of outside experts to help us with that, to advise us, to listen to these ideas. And these experts come from, a lot of them have former leadership positions at the CDC or the FDA and hold current leadership positions in various scientific institutions. So we feel pretty good about bouncing all of this off of them, hearing their feedback. They in turn are providing us insights as to what's going on out there, what are the trends, what's the current thinking as far as how do you operate in this kind of environment. Sharing that with the rest of the hospitality industry as far as hotel operators, airlines, transportation, just to get a good sense for what is out there and what people are doing. As far as when and how we go through this, a lot of it will depend here, at least by the CDC. So the plan is to provide them this information. There have been conversations with them off and on over the last 6 months. I think we're getting to a point where we will be providing the formal recommendations from us as well as the whole industry. And then we'll be waiting to hear from them. And then once we do, we'll put our plan into action. But really, in our world, it's going to largely depend upon the CDC. Touching on a little bit what was said earlier, I think also we want to make sure, even if they told us we agree with the plans, this is the way to go, we as an industry need to feel good that we can implement them and that they're operating the way that they're designed. I think that's going to be very critical. So there is, as I mentioned before, they give us the okay today. We can't necessarily turn on a switch and start operating with those plans. We'll need time to ramp up, need time to make sure they're working effectively. We're lucky that we have some operations and cruising happening outside in Europe that are using some of these protocols, and they seem to be working well. So that's giving us comfort that this is going to happen. But it's going to take a little bit of time.
Okay. And Henry, a question that has come up from our participants, which is specific to the cruise industry, is with regard to the fact that, you know, most cruise lines are incorporated outside the United States. So has there been any consideration by the cruise lines as far as changing their incorporation back to the United States as a result of what has occurred? Or do, you know, the benefits of foreign incorporation still outweigh any additional protections that being a U.S. business could provide? You know, certainly this is unique to the cruise industry. So have you given that any consideration?
You know, right now the focus is on the current situation, and really the incorporation is not really swaying what we need to do in the current environment. We've been fortunate that we've been able to leverage, you know, our partners throughout the value chain, including the banks and supply chain. So that really hasn't been an issue for us. In fact, from day one, we did not place any reliance or hope on anything from the U.S. government or any government for that matter. It was really more about our partners, our business model, and what can we do to get through this in a period that we believe is temporary in the grand scheme of things. Whether the business model itself and how we're incorporated comes into play in the future, time will tell. But really what we're focused on now is what's available to us and what we can do as an industry, as a group, along with our partners.
Okay, thank you. A question for everyone on the panel is, with the likelihood of medical costs due to the pandemic, things such as health insurance premiums, how is that going to affect your business in terms of the increased premiums for your employees, offering benefits to the employees? How are you all going to address that? We can start with Aurelio on that question.
Well, interestingly enough, our cost of medical care has decreased significantly because folks have avoided utilizing healthcare. So by staying away, your cost, whether it be a physician visit or a hospital visit or an ER visit, would have generated a claim to the insurance carrier. We have not seen that. I mean, we've seen significant changes. The only area that we saw an increase was in the pharmaceutical arena, and that is because patients still need to take their medications. So, and I do not think that the COVID situation is going to result in changing the actuarial rates that insurance companies did. This is a pandemic that has happened once every 100 years, and they cannot base what happened in 7 months into the future. Right now, the insurance carriers, all of them, are doing very well financially because, again, they're not processing claims as they used to. If you look at your auto insurance or whatever, you're getting rebates back because there are surpluses out there. Now, this is my personal opinion. Maybe in a year or two, there'll be adjustments against the period. But, you know, when we all look at our health benefits, you look at the ratio of losses to the premium. And I would venture to say that most of the businesses are experiencing very low percentage of losses to premium at this stage. But this is just a blip in the radar. It will go back to being actuarially sound based on utilization and age, sex, and everything else that is factored into the formula. But right now, I don't think COVID will result in increases in premium. I just don't see it.
Okay. Thank you for that insight. Michael and Andrew, have you all seen any difference with regard to the benefits offered to your employees?
No, nothing yet. Obviously, we have our renewal is going to be coming next year, so we'll see if any changes sound. But based on what Aurelio was saying, that sounds logical, and I think that makes sense from somebody who's not in it at all. And I certainly hope so. That would be another big blow that the industry does not need if all of our group policy skyrocketed. So I'm hoping for that, but I believe what Aurelio is saying, it makes a lot of sense to me, and I certainly hope so.
Sure, absolutely. And what about you, Henry? Any changes that you foresee?
Same, as everybody has mentioned, we really haven't seen anything yet. I agree that this really should be viewed as a blip in the radar, and we should be able to go back to a normal state.
Okay. Great. And Aurelio, questions come up, which is unique to you, and I want to make sure I address everyone's questions, but just to get your overall thoughts on the current state of a potential vaccine for COVID, and what your thoughts are about that, and then with regard to any precautions that people can take as with regard to minimizing the potential of getting COVID.
Well, one of the things that I encourage everyone who's listening is to get their flu vaccines this year. Within a month, they'll be available. You can get them from free at CVS or Walgreens. I highly encourage everyone to get their flu vaccine. We do not see the vaccine for COVID come out until later on, and I'm just going by what you hear on the media and the reasonableness of the clinical trials. We got to do it right, and we need to let science drive it. There's going to be that percentage of the population that feels safe about getting the vaccine. Quite honestly, once the public feels comfortable with the vaccine, that's a game changer. That's what's going to have everyone going back to the hotels and the cruise lines and the restaurants and whatever. And up until then, it's going to be very difficult. We do not believe that doing it without the scientific facts is going to convince the public to go out and get the vaccine. But we do recognize that if you get the flu and then you get the COVID, that's not a good thing to do. You go into that hospital, the likelihood of leaving that hospital is not likely. We have 90% of all of our patients that come in for COVID go back home. We want to make sure that that stays there or even lower. And the only way we can see that happening is take your flu vaccine now. It's free. Do it. Your employees, everyone that you deal with. And then when the vaccine comes out and there is that comfort level that is safe, I would encourage everyone to take it as well, because you never know how long this is going to go. And it's going to be, it's going to be with us for a while. Let me put it this way.
Thank you. And another polling question that has come up. And while we're chatting, Aurelio, another question has come up in that you mentioned that since there's been a decreased amount of cases, would you predict there'll be a pandemic after the pandemic? Because as you mentioned, a lot of people are either delaying or completely stopping getting routine medical care. So do you foresee this being an issue after we're through with COVID, in that people delaying their checkups, getting tests and things like that, for that to be a problem post-pandemic?
There's no question. The avoidance of maintaining your medical visits has caused the acuity level of our hospitals to increase. And it's a matter of safety, and folks have died. I've seen, we're in a community that is high Medicare population, which means 65 and older. And to put off symptoms, especially cardiac or stroke, it's not in the best interest of anyone. Hospitals are extremely safe. Everyone has taken steps to avoid the spread of the virus. So it is, how do we communicate to the public that it is safe to do it. For example, when we open our doors, all of a sudden we started seeing significant increase in the number of catheterizations or interventional cardiology procedures. Well, if you have chest pain, you should go to the emergency room. You shouldn't wait until you open your doors to have it done. There will be, like I said, who knows what's going to happen in the future with regards to the virus. But I do want to alert everyone that if you have any symptoms that require you to see a physician or go to the emergency room, that you do so. I like to share statistics in the city of Hollywood Fire Rescue. In April of 2019, 25% of all responses were dead on DOA, dead on arrival. In other words, you call 911, but by the time fire rescue there, the resident had expired. In April 2020, in this particular cohort in the city of Hollywood, it was 50 dead on arrival. So you went up 100% because they waited too long to call 911. They did not listen to their body saying there's something wrong here. Now that is not as prevalent now. Don't forget, April was the first surge. There was 2 surges in this whole pandemic, April and then July. I mean, July was 3 times as high. But in April, folks were so scared that they would not even call 911 when they knew they had to.
Wow, thank you. Henry, with regard to Royal Caribbean, the value and the shares themselves of the company have essentially held or increased in value post-pandemic. So do you foresee the reason for that growth in the value as a result of the pent-up growing demand for the cruises? What do you see as the reason for the financial strength and the ability for those shares to hold their value during the pandemic?
I guess it's all relative, right? We're at $135 a share back at the beginning of the year. I haven't checked today, but we were hovering around 70. So I guess with holding on to our value, I guess is relative. That being said, I know we dropped to as low as into the 20s at the heart of the crisis. We're one of those stocks that trade with COVID news. So it's very emotional in the sense that if there's news on a spike of positive cases and mortality rate, that drives the stock. If there's news on a vaccine or therapeutics, that drives the stock. So a lot of the movements that we've been seeing has really been about that. I think that being said, I think there is a lot of demand out there. We're hopeful on that. I think those that analysts that follow the stock see that, and it's more of a matter of how quickly we get back to where we are. I think they all see that will happen. It's just a matter of the time and the journey each one of the cruise lines will take, depending on their balance sheet, depending on kind of the different actions they've been taking and will take. But really right now, the movement is, I really attribute it more to emotion around and people guessing and trying to predict what's going to happen with COVID, as opposed to something specific about our industry.
Thank you. Okay, as we start to wrap up the panel, I'd like to ask each panelist if there was one takeaway that you all have as a result of COVID, what would that one takeaway be? And we'll start with Michael and Andrew with that question.
I think the ultimate takeaway from this, from our perspective, is very easy. Surround yourself with great people. So have the right partners. Have an attorney that you trust and that works for you. Have a great accounting team. Have a great insurance broker. A lot of times, we take for granted you just get an accounting company to do your taxes. That wasn't our experience. Our accounting company helped us through all aspects, and we consulted with them. They were a great help. Our attorney wasn't just a lawyer who started billing us the minute we called him. He helped us with everything and continued to do so. Our insurance brokers were there for us every step of the way, visiting us. They care. We have great relationships. All those relationships that we have really paid off. It's extremely important. And then beyond that, your business partner, the people that you work with. Michael and I trust each other completely, and I trust him to do what he does. He trusts me to do what I does. And then our other partners have all their tasks, like our CFO, our CIO, everybody else, all our corporate team. Everybody does their job, and they're all great. And we've worked together, and it's created a very positive experience through such a negative time, that you basically sit back and go, we're very lucky to have each other. We're very lucky to have our team. We're very lucky to have the staff that we do. And, I think it's more important than ever. We feel very fortunate to have our ownership group. We feel very fortunate to have the staff we have. I feel extremely fortunate to have Michael as my business partner and helps me run the business. That's the most important thing of all, our takeaway.
Yeah, I think the word like resilience and leadership are two of the things I think of the most when I think about like the last 8 months of my life. The human capital aspect of our business is huge. The amount of people that we employ, the roles that they play, and really, I think throughout this, I felt it before, but I think the world and people have been so fragile in the last 8 months that really working and leading the people around you has been so important. And through that leadership, learning to just care about them in a different way. There's been a lot of learning. There's been a lot of understanding. There's been a lot of just communicating persistence, and like Andrew said, it's surround yourself with great people, and then also at the same time, make sure that you ask them how they're doing. And I think, to me, apart from dollars and cents, because the first thing that everyone scrambles for, and they did scramble for at the beginning of this, with good reason, was money and finances and budgets and what do we do, and turn around and look at the people around you that are looking at you to lead them and ask them how they're doing. And I think that's the one thing that I've taken away from this year the most, and this whole situation has been, be a persistent leader and be good to the people around you.
Thank you. Great takeaways. Henry, what about you? What's your takeaway as a result of the pandemic?
Yeah, just to add what Andrew and Michael talked about, to me, when I think of what we're going through, it really shines a light on, well, what happens when the front of house just goes dark, right? Where the sales group, all of that interaction with travel agents and guests kind of just go dark. The reliance you have on your back office, whether it's the people, whether it's the process and the systems, that really then comes to the forefront to get you through this period of time. And I think, they mentioned resilience, absolutely. The adaptability, every day when you're coming in, it's another fire, it's another change to the environment that you're having to deal with. And it really comes down to the strength of the people you have working for you. That's been really critical for us. And then the systems that you have, our systems are being asked to do things, as well as our people, that we just never thought would be an issue. We're used to money coming in one way, not going out the other way in dramatic fashion, as we've seen in terms like refunds. That used to be kind of a little blip here and there. It's become a way of life for several months for us. So that, taking a look at that and understanding, when things are going well, there's not a lot of attention paid sometimes to those systems and those processes in the back office, they are now extremely critical in this period of time. And I think that's something that every company should be thinking about, and I'm sure they're dealing with at different degrees. I know we all are. And I mentioned earlier just the relationships we've had with the vendors and suppliers. That's been huge for us. We've always viewed it as important, but it's really paid dividends now in this current environment. So that sometimes there are moments where you go, well, why do we want to do that? And why do we want to do this with certain vendors? And it's for moments like these, right? So those are definitely learning just moments that I've noticed through this process.
Great, thank you. And Aurelio, what about you? What would be the one takeaway that you have as a result of the pandemic?
Well, I think that there's a common theme that you've heard with all of us here in the panel, and that is you want to put your customer and the consumer in the forefront of safety. You want to keep your employees safe. And you know what? It takes an awful lot of courage to put the safety of the consumer and your employees before consents. And I'm so pleased to hear that everyone on this call has the same methodology, because that's to me is a sign of success. Because for the long term, if you put those values in front of your business model, there's no question in my mind that your business will be successful. And the second thing is that we need to adjust. The system is not going to adjust to our way of doing things. We need to adjust to the way that we deliver healthcare, or the way that you deliver your products, whether it be the cruise lines or the restaurants and the hospitality industry. And we need to be flexible. The rules of being this the way that we've done it for all these years doesn't apply anymore. You got to throw the old playbook away and rethink the new playbook. But these changes take a lot of courage, because you're going against some methodologies that were very prevalent prior to COVID. So kudos to everyone on the panels for putting the consumer first and understanding that they need to adjust to a business model that is new to all of us.
Well, thank you. As we draw to a close of our panel, I want to take this opportunity to thank all of our panelists for their time and their insights. Definitely the common theme that I think I heard from all four of our panelists, and all of them are to be commended just for the adaptability, the flexibility you all have exhibited throughout the pandemic, the social responsibility that you all have exhibited, both to within the community and to your employee. And also, I think what I've heard that's been key to you all making it through the pandemic are the relationships that you all have developed, both in the community, with your vendors, and with your trusted advisors. So definitely some common themes that I heard from all of our panelists. So again, thank you to our panelists. I also want to thank everyone for listening to the presentation. And with that, we'll bring this to a close. Thank you.
Thank you.
Thank you.